All right.
Oh my God, now it's working.
So I'll jump to report 2. Howard, I'll let you unmute yourself and say anything if you have any questions. Otherwise, I'm presuming that you are following along and happy with this. Okay. Report 2 summary. Report 2 is our profit and loss fiscal year to date month of April. So report 2 for April, total income was $138,585.38, contributing to a year-to-date total of $2,614,743.85. Expenses for the month amounted to $138,276.62, slightly more than the income for the month, or slightly less, I'm sorry, than the income. Year-to-date expenses reached $1,959,000 and $44.79. These covered expenses include categories such as community health contracts, our grants, payroll, office operations, legal and accounting, and utilities. Additional revenue sources, including interest, grants, and unrealized gains, brought the total income to $449,989.71 year to date. After accounting for depreciation and other adjustments, the net income was $56,462.23 for April and $1,714,223.13 for fiscal year to date. Again, that's just really the 1 month snapshot. Any questions there for anyone? Okay. We'll jump to report 3, the summary, where we'll start with the budget versus actuals for the admin class. Total income was $2,612,198.85, exceeding the budget, which was 2.382 and more. Total expenses amounted to $1,455,710, slightly over the budgeted amount of $1,400,131.83. Expense categories, same as listed above. With several line items both under and over budget. We had a few that we can look at in just a second here. Other income sources, again, include grants, interest, unrealized gains, added that $449,000 to the total revenue. Again, after accounting and other expenses were included in the community development disbursements and depreciation, final net income was $2,255,047.89, which surpassed the budgeted net income of $1,101,071.12. So if you want to look at report 3 under administration, typically this is where we will look at our actual budget, over budget, and then the overall percent of the budget year to date for any of those percentages that seem remarkable or really kind of out there. And there wasn't really anything phenomenally different that we haven't spoken about in previous months. Where you'll see larger percentages, it's usually a very small dollar amount overall in comparison to the budget. Sally, did you see anything there that you had questions on or clarification?
Well, I mean, it was nice to see that the rental income.
A little bit, yep.
Close to it, yeah. And get some of the other ones that I, just went through. Into total office expenses is up significantly.
Yeah, I mean, the amount of difference is 6,000. A lot of that had to do with software. what you'll see is there are a few pieces here and there that, get out of control. Medical record expenses is obviously something we can't control. That was I budgeted 30,000, we're sitting at 39. And that's with Iron Mountain, and there's nothing we can really do about that. Judith, Raquel, and I just recently had a conversation about how we're updating our record retention plan so that we can start to pull a lot of those records that are at this point obsolete and should be shredded. Iron Mountain is incredibly expensive to do that. So what we're talking about doing is once we clarify the retention record, we will have those records sent here to the district, and the district will go through to make sure that what's in the box is actually what they say is in the box. And what needs to be shredded, we will identify and have a shredding company come out and certify that. But we're going to handle it in-house. Currently, there's about 15,000 boxes of records.
And this is from the hospital.
These are from the hospital.
And so
Holy
this
smoke.
year, we're able
I have
to like
no
go
idea.
more. because
In-
we have to hang on
Yeah,
to
the
them.
point is each year we should be able to shred. I would say for the first 5 years after the closure of the hospital, nothing was done with those records. Since Judith came on board, Raquel and Judith and I have talked about what can we do to begin to try and purge what doesn't need to be purged. Just as a side note, we had 2 boxes that we checked out and had sent to us that were marked as miscellaneous. Let's air quote miscellaneous. And what we found in there was miscellaneous.
Miscellaneous.
It
Sign-in
was
sheets.
Sign-in sheets to events and lots of different things. So not necessarily paper records that needed to be held for patients. Some accounting records and things that are now past their need to keep date. So we're paying a lot of money for something that we can scrub. Trying to pay Iron Mountain to do that, they have to take images of something, which they charge you. Then they send you those images, and then we say we want it destroyed, and then they charge us again to destroy it. Or we can just pay one time, have the box sent to us. And stuff that are sign-in sheets that don't have a, health protected information, we could just set through basic shredding. So know that that is one of those expenses that we are going to be working diligently on through the fiscal year 25-26, the upcoming, to get that down. Software and websites, you're going to continue to see that go up. The reality is pretty much everything we do is a software these days. So that will shift, and we're still trying to watch that. We had some office supply things that we had to upgrade, and so you'll see a few things there. But I think we're getting the balance of that pretty well organized. So I'll move on to the Wellness Center for report 3, unless you have any other questions on that one. Okay. For Wellness Center, again, we don't really count their income too much because with the construction, we weren't really renting out the main building. So total income was $2,554. We had budgeted 6,000, not knowing obviously when buildings would be open and or usage. Actual expenses amounted to $503,334.76, which was under the projected budget of $662,953. Same key expenses. So we're consistent with payroll, basic operations, health services, utilities, and support services. Our payroll closely matches budget projections. Other categories came in under budget, including health services, events, legal fees. After including 40,000 in depreciation expense, the net income stood at a negative 540,000, which, to be honest with you, is what we expect because the district is funding that program. We don't expect it to ever be a revenue neutral, but that's just something we note in the report. So if you look at that, you'll find that on page 10 and 11. Same thing, you'll see the actuals, budget, over, under budget, and the percent of budget. Other than income, which is, pretty well under that. Their expenses have been pretty well managed. The biggest one that's under budget really has to do with district direct care services. Again, that will likely happen because we're starting each budget year with the goal to bring in more clinical services. And when that doesn't occur, that means we also haven't paid for it. So that's where you see this largest quote unquote savings, because we haven't spent those funds. The goal and expectation is that we will invest in those services when they come online. Really other percentages of note, everything else is pretty close. And nothing else is truly remarkable from my standpoint. Anything?
No, I thought you explained it well.
Okay. All right, then we can talk about the compliance report summary, which covers reports 4, 5, and 6, which is our CalTrust, our LAIF, CalTrust, and California class. You'll find that Susan has submitted her compliance report. You'll find that in there, which has the specific percentages and yields. I will not go over reading those because again, we're looking at a fairly consistent set of numbers in that. I will point back to a previous finance meeting where we had talked about having a financial advisor potentially help with that. We did have a brief interaction with Rick Wood from CSDA Finance, who likes to get into the nitty gritty. I believe you met with him or was in a class with him, Sally, where he definitely knows his financials, but goes deep into the weeds, which is great for water districts and those complicated financials. We will still potentially try to see if there is a finance manager. But one of the things he indicated was that with the amount of investments we have, the cost of an investment advisor might not be worth it for us. So we'll still continue to look at that, but that may be a slower thing that we'll bring forward. Okay. So unless anyone wants specifics on the compliance and investment reports, I'll skip that and jump us to report 7. Which you'll find on page 16, which is our check detail report. And again, that is one of our transparency reports. You'll see each check that we've written, so that it's easy to identify where monies have gone.
Not seeing anything.
Again, nothing truly unusual. You'll see that there was a not really a new vendor. We've only paid them one at a time, which was Best and Krieger, which is another law firm, which previous legal Jeff Scott had directed Judith and I to regarding some questions on how CalPERS benefits. We received some guidance from them, and this was their final payout. At this point, we'll probably roll those questions and programs over to Colantino, Highsmith, and Watley, which is Alex law firm. So I doubt you'll see that one again. Everybody else is our standard. You may begin to see a few checks in here for new vendors that will align with the district's direct care services at the wellness center. For example, on page 20, the second check from the end is Small Steps Coaching. There's a $100 stipend style check for that facilitator. So you'll see a few of those as we're bringing in different providers to help us with some of the district's health education. Okay. Again, usually going to be smaller amounts. Okay. Unless there's any questions from that. All right. So report 8 is the credit cards. So you'll see that we still have Umpqua on there, and we use that as backup when necessary. And then we have a couple of things that roll over onto that card, but the majority of fees charges go to our 5-star account. And so those are all, again, pretty standard. We had, I think, one missing receipt this month
$6.
for $6. I'm throwing Teresa under the bus.
Uh-huh.
But we have a process where if a receipt is missing, we go to the person, we identify what that was for. Usually it's pretty simple. In this case, it was very obvious. It was while Teresa was at the CSDA training, and I think it was like the coffee or the breakfast at the hotel or something.
Yeah.
It was very clear what it was from, and it was easy to follow through. So unless there's any expenses on there that seem unusual, nope.
Oh.
All right. I don't hear anything else from Howard
No.
either.
No, sounds good.
Okay, good. Just making sure you were still with us.
I am, and I am now home.
Oh,
Almost.
Oh.
all right, perfect. So report 9 is our community development disbursements review. That one's a little hard to see because the font is teeny tiny. But it again is where we keep track of all the various funds that are reinvested back into the district properties, primarily the Community Health and Wellness Center, but for admin to catch up on previous deferred maintenance projects for the most part. Are from July of 24 through April of 25, our project related expenses totaled $750,007.06. 20,835 was specific to the administration building. The remaining 729,000 had to do with wellness center. And again, those are going to be things for design, planning, engineering, construction services, and equipment specific to the setup of the wellness center. So those are usually longer term items. Sometimes they are the investment in having enough chairs, tables. Those aren't really at maintenance level yet because we're still filling the center. So as rooms have gotten finalized, as rooms have gotten put into use, we've started to buy the more durable equipment for those facilities. In the future, the expectation is as they wear out, that goes into the basic operating budget. Okay. And that is the end of the financial statements for April 2025. Any questions? Nope. Okay. I'll move us over to section 4, discussion possible action item. The finance committee doesn't need to do anything. I will typically sign the engagement letter with our auditor. Again, we're staying with the same audit firm, Nigro and Nigro this year. We expect the exact same stellar, easy process that we've had the previous 2 years, where Nigro and Nigro has already actually sent out information to us on how to prepare for the upcoming audit, things to put into place. Susan has working documents that she puts together. I was mentioning to Sally before the meeting started, we have a great working relationship with the auditor as far as process, understanding, and expectations of roles, who does what, how it's supposed to be done. So we do not anticipate any challenges in it. So after this meeting, I will sign that engagement letter. I will send it back to the auditors, and we'll go ahead and officially begin the process for this, doing the audit for last fiscal year, which is the one that ends on June 30th of this year. So obviously they can't do too much because we haven't actually ended. But they do start pulling other documents and getting things ready, which is why they can be very quick and thorough, yet at the end. So again, Susan, anything you want to say about Nigro? No? No?
Great.
Okay, so that's just more of a letting you all know that that is happening. Other than that, I have no other things for the agenda. This is point 5 now, where if you have any comments or future agenda items that you would like to discuss.
For me.
All right. Howard, anything for you that you would like to make sure that we put into future meetings? Yeah, he's still, phone is still active.
Mm-hmm. Oh, he called back. Hi there.
Hello there. Sorry, I couldn't get to my mute button.
Oh.
Yeah. So we were talking about the financial manager and our friend at CSDA's thought. So I guess we just need to think amongst ourselves how much we might be willing to pay that may make sense, and then contact folks and say, are you willing to do this for what we're willing to pay, and see what happens.
That, and or we could do where we'll go out to 2 or 3 of them and explain this is what our portfolio looks like. What are your typical fees look like? I'm not so sure I have enough knowledge to put a fair value on the expense of what that will be. So I'd like to work that backwards and have them provide us what they would anticipate the fees are. And then we can identify whether or not that fits our need versus the cost. You know, what's the ROI on that? So.
Better idea.
Okay.
Yes, I agree.
Okay. So we're still going to look into that. We're just less motivated to bring that forward after that other little bit of information.
Right, I understand.
Okay. Anything else for comments or future agenda items?
I can't think of anything right now that, financials look really good and you guys manage it well. So it'll be a good basis for development of the budget for next year.
Great. Great.
I had a question, Rachel.
Yeah.
Did Rick Wood mention anything, maybe perhaps on like on a fractional financial manager, somebody that's not dedicated, but just like on a, specific amount of time?
You know what? He didn't, but that's probably a great follow-up for him. Someone who doesn't necessarily have to manage the portfolio, but can kind of provide us with investment guidance on an as-needed basis. Is that
Yeah,
captured?
somebody fully licensed, like a CFA, but on a fractional basis, who can help guide us and have conversations with us a couple hours, a month, whatever it takes, that they could just give us guidance that we can follow through on doing all of it ourselves. Because we
Yeah.
don't have problems moving the money around and doing the administrative work. And we can hold conversations with them, with Susan and all of us, kind of together. But some of that very specific questions we may have, where we're just not sure about some of the things about like the market and stuff at the very tail end, where we would need their expertise. So maybe something like that would work for us.
Yeah, that's a great idea. So we'll, when you're back in the office, we'll have a sit down and we can reach out to a few of the probably primarily referred via CSDA. There's several that are in their approved vendor list, if you will.
Right.
And we can
Okay.
kind of see if we can get some proposals from those folks.
Sounds good. Thanks.
All right, good idea.
Good idea.
Okay. Other than that, our next finance meeting is on Wednesday, July the 2nd at 10 a.m. And
I'll be sure to put it in my calendar.
okay. Well, maybe Raquel can send out a reminder calendar invite so that it can drop onto your calendar.
That sounds great.
Okay.
See you later today.
All right, then we'll go ahead and adjourn at 10:39.
very efficient.
All right.
Good job, Sally.
All right.
So,
Thank- Thanks, everyone.
Thank
Bye-bye.
you, Howard.
Bye. You bet.
Thanks, Judith. We'll talk to you later.
Yeah, something's a mess.